All right, you're recording.
All right, there we go. Nice. Good morning, everyone. Welcome to With Steel, Flame, and Honey, with a question mark, Treating the Wounded in Late Medieval Europe. I'm Etienne de Montagu. I am teaching the class, and just a couple of kind of disclaimery things that I want to put out there from the outset is I am not a medical professional. I am an enthusiastic history-minded person who finds this topic interesting. I've taught this class multiple times, including 2 medically trained individuals ranging from EMTs up to a NASA flight surgeon. And so far they have yet to find any major flaws in it, which makes me happy. So right at the outset, let's look at our friend here on this cover page. This is a figure that appears oftentimes in the medical literature of the Middle Ages. This is known as the wound man or the wounded man. And I'll get into him a little bit later on, but he is an interesting figure, and he's a good example of one of the things that I'm going to be trying to teach in this class, which is that medieval surgery was a good deal more sophisticated, more rational, more intelligent than I think we sometimes think. So what do we tend to believe about medieval medicine? When I started doing this class, I decided to just ask folks, what do you know about medieval medicine? Tell me something that you believe that you know or whatever. And things that came up. It's unsophisticated, it's unhygienic, it's brutal. It's an inconsistent mixture of superstition and luck, based more on theory and observation. The humors and astrology, heard that a whole lot. Bleeding your patient dry, and that medical learning was suppressed by the church, so surgeons were little more than untrained butchers. Well, while I'm sure there were surgeons in the Middle Ages who were not great, perhaps not well trained, the fact of the matter is there was extensive training available, extensive education available. And when I started researching this, I was surprised actually at the level of sophistication. So this is one of those you thought you knew, well, here's the truth classes, I guess you could put it. For at least the first part of this class, we're going to talk a lot about a fellow named Guy de Chauliac. He is probably the preeminent surgeon of the late Middle Ages. And he was born around 1300 in the south of France, educated in Toulouse, which was a major university, and at the University of Montpellier. It's interesting, he wasn't a priest, but he was a churchman. And this is one of those weird little distinctions that we get into in the medieval period sometimes. He actually took holy orders so that he could pursue his education. So he essentially lived by the rules of a priest, even though he was not ordained as a priest. In his education, he studied dissection in Bologna, surgery in Paris, and he actually qualified as a physician, not a barber surgeon. Those were 2 different positions. There were 2 different guilds. He was a physician who practiced surgery. He served as the physician to 3 of the Avignonese popes when the papacy was in Avignon in southern France. The lifespan of Avignonese popes wasn't particularly long, I would note, due to political infighting as much as anything else. Guy actually survived and wrote about surviving the Black Death. And then late in his life, he wrote Chirurgia Magna, the Major Surgery, in 1363. Why is writing a book on surgery important? Well, let's talk about that. I'm holding my English translation copy of Chirurgia Magna. Hope y'all can see this. Um, it's very thick. It is very thick in English translation. Granted, there's a lot of notes in here, but it is still just a bloody thick work. He wrote it in 1363. It was circulated in manuscript form in multiple languages and editions until it was finally printed in 1473, once moving type press came along. There are over 70 editions of it, including translations into French, Provençal, which is the southern French language, Dutch, Catalan, which is a Spanish language, English, and Hebrew. It's divided into 7 treatises devoted to anatomy, or parts of the, so anatomy, swellings, wounds, ulcers, fractures, special diseases, and antidotes, the antidotary. It's important to note that that's in there because he was a physician, so a good deal of what he was concerned with was mixing medicines and making medicines to treat things. So the antidotary is extensive and not something I've taken a deep dive into. It's not my primary interest, but for someone who would be interested in herbalism or pharmacology, it's a treasure trove. Each treatise is written so that it has a general doctrine, then followed by subchapters that are based on a particular site or body region. He's very thorough in this. He's approaching it from a very methodical point of view. Something that I want to remind us of that we sometimes lose track of as modern people is that medieval people were just as smart as us. They were just as capable of rational thought as we are. They were oftentimes better observers of the outside world than we are. When we get to medicine, there's this notion of superstition and astrology and humors and all of that. Every one of those systems that they were working from was logical. It is internally consistent. It is based on what they could observe at the time, and it follows some very definite rules, so it wasn't just mumbo jumbo, so to speak. The important thing about Chirurgia Magna, where we can see its impact, is that after it was written, it was published in manuscript form for 110 years. That means someone went through the trouble of hand copying this mucking great work, translating it into their own language, and then making it available. This was considered important. It was considered necessary. It was actually written part of the French medical educational canon until the 19th century. The book is largely based on the work of Hippocrates and Galen, who were the fathers of medicine in the ancient world. But he also incorporates the work from Egyptian, Persian, and Arabian physicians from the 11th to 13th centuries. When the Crusades happened, there was a tremendous flow of information coming back to Europe from the various nations of the Levant and the Middle East. And a lot of that knowledge was what a fellow named Winston Black calls Islamicate. These are oftentimes Christians living in Islamic countries, but they've been educated in that culture. They've been educated in those schools, and they're oftentimes writing in Latin because that was still the thing. This is a wonderful bathroom reader. I recommend it highly if this is at all a topic that you're interested. It's Medicine and Healing in the Pre-Modern West, A History and Documents by Winston Black. It's all in translation, but it's nothing but primary sources, and it starts with antiquity with an Egyptian charm and moves into the Middle Ages. So it's a really great read if you like this sort of thing. But anyway, de Chauliac included 32 references to the works of other physicians in Chirurgia Magna, which tells me he was a very well-read individual. I mean, you're basically basing this great work of yours, and Chirurgia Magna basically means the great surgery, and he's referencing 3,200 other works in the process. Again, This guy is smart, well-read, knows his stuff, educated. And the interesting thing about it and why it's a particularly valuable book is that it incorporates the lessons of those past works with practical observation, clinical experience, and critical thinking. There's a quote in there that I'm going to read here that I like a lot, because he says, "They have, to my mind, understood very badly Aristotle's second book of metaphysics, where he shows that these two things, fear and love," and I thought I fixed the typo on fear and I didn't, "are the obstacles to the road to the knowledge of the truth. Let them give up such friendships or fears, because while Socrates or Plato may be a friend, truth is a greater friend. Let them follow the doctrine of Galen, which is entirely made up of experience and reason, and in which one investigates things and despises words." This is really important because he's railing against the medical establishment that at this point even is so hidebound that they simply say, well, Galen says this. And he's saying, well, Galen also says, go see for yourself. You know, don't just fall back on these books that are 1,000 years old or whatever. Go out, do the medicine, make note of what you're doing. This is basically scientific method in action. So what is surgery in the 14th century according to Guy de Chauliac? What did it include? Well, it included inhalational anesthesia. It had nods to antiseptic surgery. They did not have a germ theory of disease. And I want to make sure that we're not saying, well, look, they were ahead of their time because our doctors do these same things. They saw things that worked and noted it and did better. So they knew that if they cleaned their tools with wine or with vinegar and used clean bandaging and that sort of thing, their patients had a better recovery rate. It's basically pragmatism, but they understood on some level, try and keep the wound clean. Removal of foreign bodies, hernia repair, basically as an elective surgery, cataract treatment, as an elective surgery. De Chauliac talks about removing cataracts. He used very fine, sharp knives. He used silver wire for the suture. He could remove a cataract. And if you think about it, since he was working largely in Avignon around the papacy, that's a religious center, eyesight matters a great deal to people who are largely living an internal life with a whole lot of reading and everything else. So I think that's an interesting specialty of his. Suspension and traction for femoral fractures. One of the problems we sometimes run into when we're studying the Middle Ages is that, at least in the SCA, is that most of us grew up in the American or Canadian education systems, which are very Anglophile, Anglophone. We tend to lose track of what happens in the rest of the world. According to English medical literature, there are a couple of treatments for femoral fractures that were invented in the 19th century. If they had bothered to read de Chauliac, they would have found him using them in the 14th century. And the French were saying, no, you're wrong, England. We use them over here. We have for a long time. And he discusses treatment of wounds to all parts of the body. So how do we know it worked? You know, it's all well and good. He wrote this big book and he says, hey, I've got this stuff. I've done these things. I know these treatments. How do we know? Well, we don't have medieval Yelp where they can give de Chauliac 5 stars and say, yes, he fixed my cataract. But there are things we can look at in the historical record. And apart from the fact that they published his work a lot, the archaeological record can yield some useful information. For instance, this thing you're seeing on the screen right now. This is a femur, a human femur that was dug up at a site called Aljubarrota in Portugal. It's a site of a battle fought in August of 1385 in Portugal, and was excavated, I believe, starting in the late 50s, yes. In 1958, an archaeologist began excavating the site and found somewhere between 4,000 and 5,000 bodies at this site. It's the second largest single site, battle site excavation after Visby. This particular femur is interesting because it's from one of the soldiers that fought in the battle and died on the field and was buried in one of the mass grave pits. This femur shows signs of medical amputation. The way that the bone is rounded and worn there at the tip on the right side of the photo, that's remodeling that happened post-healing, and the way it was cut shows that it was cut medically. So this is someone who medically had his leg amputated at the thigh and went on to not only heal, but to continue a fighting career before he died at Al-Hubarota. So I think it's an interesting case, and we can find a whole lot of those. In 2016, Robert Wisdom Savage from the Royal Armories and Kelly DeVries from Loyola University did a massive survey of the archaeological catalog of remains found in medieval burial sites, looking for signs of trauma, injury. Basically, they called it battle trauma. It's a paper I've got here. Battle trauma in medieval warfare, wounds, weapons, and armor. And they were using it mostly to talk about kind of cataloging the wounds that these bodies suffered. But they do note in multiple places where old wounds have healed, which means these guys had gotten hurt and kept going and healed up. Granted, the bones can only tell part of the story. We can't see the soft tissue damage. We can't see, cuts. We can't see any of that. All we have are the marks on the bones to go with, and oftentimes there's not a lot to deal with on that. This fellow here on the slide, he's an interesting bit of history. So this is a fellow who is now called the Hereford Knight. Hereford Knight. 2009, archaeologists were doing a dig at Hereford Cathedral in England as part of a restoration project. They excavated a graveyard and found more than 700 skeletons dating from the Norman conquest through the 19th century. So wide range there. This fellow here, though, is really interesting. He's a man, and his wounds indicate that he may have been killed in the joust. He's big. He was 5'10". Isotope analysis of his teeth showed that he was originally he was raised in Normandy. Put those together, and you've got a likely man-at-arms of some sort. Very possibly a knight, given the time of his burial. His medical history is what's so interesting. He had a badly fractured right shoulder blade that was fully healed by the time of his death, and a serious break in his lower left leg that had also healed. It's a twisting fracture. So the implication of this, if you think about a knight jousting on horseback, he gets hit in the right shoulder, twisted off of his horse, his shoulder gets broken by the initial impact, his left leg gets fractured as he's thrown off, and lands. These are wounds he recovered from. And from the remodeling, it's clear that those wounds had healed years before the final wounds that killed him. He sustained at least 9 rib fractures on 2 different occasions. The second occasion only shows signs of a few weeks worth of healing, so possibly that was related to the injury that ultimately killed him. We can't say that they came from combat, but they certainly came from violence, and he recovered from them. So I think he's an interesting case of possible evidence of a medieval fighting man who was wounded and moved on, or recovered from it and received suitable treatment. And this is a couple of centuries before de Chauliac. All right, so we're focusing on treating the wounded here. So I'm going to move to Chirurgia Magna's third treatise, which is devoted to wounds and wound care. There's a general chapter of how we treat all wounds, and then the second doctrine is aimed at individual body areas. There's also a fifth treatise devoted to fractures and dislocations, which de Chauliac differentiates from wounds, and I'm happy to ignore that because fractures and joint injuries really squick me out, and I have trouble reading about them even, much less describing them or considering them in depth. So maybe someday. For some reason, wounds are more of an analytical thing. So we've got another wound man here. This is a bit of an earlier one, and I want to kind of talk about what he's about. I mentioned him before. So this poor guy, he's all beat up. He's been stabbed, he's been beaten, he's stepped on a sharp stick, he's stepped on a knife, he's got wounds all over his body. What are these things? We see them in the books. What this basically is a handy rubric for the doctor. Maybe I'm a surgeon and maybe I got trained 10 years ago, but in that time, for whatever reason, I haven't seen someone who has taken a deep wound to the abdomen. I can turn to Wound Man, I can look at that picture, and this will show me where in my manuals I need to go look to refresh my memory about the treatment. So this is essentially what we would call in my mundane job, which is IT security, this is a playbook. You've got this, you treat it like this. You've got this, do that. So, again, this shows a level of thought and sophistication we need to keep in mind. And something like this would have been available to your average barber surgeon who had been guild trained, and probably apprenticed. It wasn't just a matter of some guy decides I want to treat people and he picks up a knife. There's still guilds, there's still training, there's apprenticeships, there's masters, there's all of that. So, the first step in treating a wound is assessing it. And Guy devotes extensive text to the subject of this. He talks about what wounds are likely to be lethal, those which are treatable. He, with again the sort of practicality we expect from the medieval mind, doesn't spend a lot of time on wounds that are going to be fatal. He doesn't need to waste words on them. For instance, a wound that has opened the bladder was effectively, as far as he was concerned, 100% fatal. That's it. It's over. Move on. He notes what's likely to be treatable. In his reasoning, he's following the Galenic principles. He's following the humoral theory. But his logic is consistent and clearly in line with practical observation. And that's the important thing we have to keep in mind is, one, that he's internally consistent. Two, he's reaching these conclusions that are often right, just to our eyes, they're wrong. So for instance, a wound of the pericardium near the heart. He considered this serious, but possibly treatable, but the reasoning behind it didn't have to do with the fact that the heart is the blood that pumps, or the heart is the pump that moves the blood around the system. It's the center of the circulatory system. It's that the heart was where all of the black bile went to be redistributed through the body. And if you remove that, then all the black bile flows out and the patient dies. He's not wrong from his reasoning, but he's basing it on a different set of logical rules. And that's the thing that I want to keep in mind always when we're thinking about medieval science, is how internally consistent it often was, and how oftentimes it reached the same conclusions as we do, just coming at it from a different starting point. You see this in astronomy and astrology as well. They were observing the same sky as we are. They're just observing it through a different framework. In assessing the wound, he also shows a strong understanding of anatomy and mentioned studying dissection in Bologna. It was actually a good place to address that little myth there, that the church suppressed anatomical knowledge. The church suppressed dissection. Dissection was this illegal, shady thing. The church licensed dissection to certain schools, but the church allowed it. This is one of those myths that has cropped up, and as best as I can figure from what I've read, this myth basically comes about sometime after Martin Luther, after the schism. Because once you have the rise of Lutheranism, the rise of Calvinism, the Protestant schism, and all of that, you have anti-Catholic backlash in large sections of Europe. And along with that anti-Catholic backlash comes anti-science, anti-learning. The church was a bastion of learning before the schism. And even afterwards, it trained scholars, it trained scientists, so when we talk about dissection, this wasn't a taboo, but it also wasn't as common as it is in modern medicine. Why is that? Well, because anybody living in medieval Europe knew what the insides of once living things looked like. Every day when you walked through the market, you saw animals that were being butchered. You saw the insides of pigs. If you were, if you were exposed to any level of violence, you knew what the insides of people looked like. The doctors knew enough to know that the insides of a person and the insides of a pig are basically the same. So they knew the structures. They knew the various pieces, and as a result, they didn't have to cut apart human bodies nearly so often. So when de Chauliac is assessing wounds, even when he's noting the likelihoods of lethality, once in a while he'll throw in a little anecdote about, I know about this one case though, where this chairmaker in Paris had his brains dashed out, and it was very, very bad, but they were able to close the fracture and stitch him up, and he survived, though all he could do now is sit in a chair and smile instead of make them. But he notes that some of these horrible, theoretically lethal wounds could be survived. What's notable in his assessment process, from my frame of mind, is obtaining consent, getting permission from the patient, from the patient's family, or from church authorities. Some of that is doubtlessly CYA. You're basically making sure, there's no medical malpractice insurance, but I'm sure that if someone practiced surgery on a patient who died, their family might have questions and might go to the church, because that's a big piece of enforcing the civil authorities. But he notes you need to have permission to do this. I think that's a cool thing that, again, we don't think about when we're considering medieval medicine. So there are 5 general measures that apply to the treatment of all wounds. First off, clear the wound of foreign matter, getting foreign bodies out of that, clean it out. Bring together the separated surfaces of the wound. So get it back together as best as you can. Restore the normal conformation. So that's with bandaging or sutures or cauteries. When he's talking about sutures, he talks at length about the needles that you use and the fineness of the linen thread that you should be using for your sutures. And he talks about how you need to always clean your needles with fire or with vinegar or wine, and that you should use new clean linen whenever possible. Again, he understands the notion of sanitary medicine, even if he doesn't understand microbiology. You then preserve the normal tissues, and this is done through medications, ointments, unguents, as people like to say, that sort of thing. Various medications to preserve the normal tissues and treat complications as they arise. So pain, abscesses, fevers, those sort of things. Those would largely be treated either through, so with pain, he recommends using poppy juice. And I mentioned earlier on, I should have expanded on a little bit, that when I was talking about the surgery, that they had inhalational anesthesia. This is one of the really cool things I discovered in all of this, and it's one of those things that we've lost sight of because we're all modern and smart, and weren't they just a bunch of butchers? 13th century in Italy, they had figured out that if you take poppy juice, soak sponges in it, dry the sponges out, and then when you have a patient you need to knock out, boil water and pour boiling water over the sponge and have the patient breathe in the fumes, it will knock them out and induce them in a sleep that you can do basically painless surgery. De Chauliac notes this in his work. They knew that poppies were good painkillers, and they used them. And I think that it was a fairly common practice. Again, I can't prove this. I need to go and do more research on it. But I think a lot of our stereotypes of the patient in agony while the surgeon works on him, and the only thing they've got to make it better is beer or wine, I really think that that is a Victorianism. I don't think it's true. I think they had better pain management than we like to give them credit for. The interesting thing is that all 5 of these measures still basically apply to surgery in the 25th century or 21st century. When I ran this class by Master Galen of Ockham, who's a NASA flight surgeon, he said the only thing that surgeons do different now is that they try to head off those complications in phase 5 before they arise. So that's oftentimes why if you're having some sort of medical procedure that's going to involve some degree of surgery, you'll get a prescription for antibiotics a day or two in advance. So that they start you on the antibiotics before they actually open you up, so that your body's already got some tools in place to do that. But still, these are the basic tenets of treating a patient surgically now. So let's talk about some of the measures that would be used in surgery. And I'm going to try and show this. This is my cute little surgeon's kit. I bought it. It's Indian. It's for show, not use. It's actually every single blade on it is terribly blunt, but it does have some nice little tools on it. And I will try, once we can actually go out and go to events, I'll try to make sure I've got it in the car, so if someone wants to see the surgery kit, I can get it, bring it in, even though I don't always need it. So, but they are fairly sophisticated tools. So this is a good example of something they're having to do to deal with an infection. So from the Chronicles of the Deeds of Don Pero Niño in 1440, it shows an example of the more extreme needs a surgeon might need to take. Now, Dom Pero was a Portuguese nobleman and basically a pirate. He was awful. He was really, really a bloodthirsty bandit of a man who, because of the proximity of Portugal to North Africa, would go south and wreak havoc a lot. The Chronicle of the Deeds is essentially fan fiction devoted to him. It's a very glowing book, so one has to take this with a grain of salt, but I think the basic situation described has enough truth to cite it. So Dom Pero was down somewhere, I think in Libya, and got wounded. Sailed back to, actually in Spain, to Sevilla. During that time, I guess he didn't have a surgeon with him, or his surgeon wasn't particularly good, because by the time he got to Sevilla, the wound was horribly infected. And the best surgeons of Sevilla, who, okay, these are Spanish surgeons, which means they probably have an Islamic education at this point. It's still before Ferdinand and Isabella kicked the Moors completely out. So the best surgeons advise amputating the foot to save his life. That's their first go. They look at this and they say, man, we can't save this. We're gonna have to cut it off. And Pero refused. And they said, well, the only other thing we can do is cauterize it and hope. Because actually cauterization was further normally an earlier step than amputation. But okay, if you don't want to amputate, we'll go back to cauterization. And the surgeon balked at applying the iron. I'm guessing because Dompero's reputation was so bad that he didn't wish to hurt the guy and possibly get killed while trying to heal him. That's my thought. So in the chronicle, brave Dompero applies the iron to himself not once but twice in order to get everything. So he's such a badass. He basically puts a white hot iron against his skin and burns out the infection all on his own. And after that, the wound was dressed and healed. And we know he ended life with 2 feet. So clearly the procedure was effective. But it shows that, to me, this shows that, again, there's that internal logic. There's that notion of, well, this would be best. It would be best if we just amputated, because then we know we're going to get the infection. We know you'll recover from that. But here's this other treatment if you want to try it. And he went for it. Here's a more extreme method, and I love this one. I love this, the medical crossbow. Early 14th century surgeon from the Netherlands, so named Jan Yperman, illustrated this method of using a crossbow to extract arrows and other objects deeply embedded in the body. And it consists of a clamp that goes onto the string of the crossbow, and then that clamp affixes onto whatever you're going to be pulling out. So in this case, he's showing a leg that has been shot through with an arrow. So you take your clamp, you put it on the arrow, you cock the bow, you loose the bow, and it yanks the arrow out. It's like mom yanking your tooth out with a string when you're a kid. And when I first heard the term medical crossbow, I must have laughed for a good 2 minutes straight before I actually looked it up and looked at this, and it makes so much sense if you understand the mechanics and engineering of the Middle Ages. A crossbow is probably the best way to store a massive amount of kinetic energy in something you can hold in your hands. A real medieval crossbow, not what we tend to use for target shooting in the SCA or war in the SCA. A real medieval crossbow is an incredibly powerful hand tool. When I showed this class to my friend Master Godwin from Bjornsborg, who's a blacksmith, he took one look at this and he went, I've seen this same tool used to yank locks out of doors, which again makes perfect sense. So I'm sure this was actually adapting something that other trades did to a medical purpose. But I love it, and it was well known enough to be cited in other works. Henri de Mondeville wrote about it, a French surgeon, and there's even a picture of the medical crossbow in use in de Chauliac, so he was using it as well. So I love that. I love the medical crossbow. Complications. So we've talked a bit about this. Guy insisted on strict cleanliness and using wine and vinegar to clean wounds. Medical surgeons were still working in very septic conditions. There's no way around that, particularly during warfare. That's the worst situation. Managing pain and infection were major considerations. We already kind of talked about this in terms of the pain with poppy juice to deal with the pain. And fevers and infection were fought with many medications derived from herbs, fruits, vegetables, and honey. Let's talk about honey, because that's a part of this class. And that's actually the piece of this class that's where this class started. Quick plug, there is if you listen to podcasts, the medieval podcast published, it's just called that, and it's published by medievalist.net, which is a web resource for medieval history. The medieval podcast had a guest on one day, and one of the things I actually love about that podcast is they'll say, today we're going to talk about honey and treating wounds, and I'm like, okay, whatever. And by the end of the podcast, I'm like, wow, that's the most interesting thing I've ever heard. And it happens again and again with their topics. They're really great at getting guests who are enthusiastic about what they're doing. So one of their guests was a professor from a school in Pennsylvania, Dr. Alana Krug, who's an expert on 14th century military logistics. And in her studies, she was looking at exchequer accounts from England around garrisoned castles. And she noticed that the provision lists included honey, but it didn't include honey in the sort of masses you expect if you're feeding the troops. The honey wasn't sufficient in quantities for even mead making. It tended to be like 10 pounds of honey, and it would be reordered from the suppliers on irregular basis. So it wasn't like every month we need 10 pounds of honey. It might be we need more honey, and then 6 months later we need more honey. So she was trying to figure out, why is that? That's a weird anomaly, because all these other things are being ordered like clockwork. Or we can see, okay, the Welsh were rebelling, so we needed to uptick our stock or whatever. So she couldn't find the correlation. So she theorized that these stocks were for medical use, and she wrote a paper, The Wounded Soldier, Honey in Late Medieval Medicine, which is a great paper. It's going to be a book, I'm led to understand. Weird little footnote, Dr. Krug was one of the people responsible for Duke Gabriel in the SCA. He met her at a college medieval thing. She was an SCA'er at the time, and she took him under her wing, and actually was one of those people who got him going in the SCA early on when she was still in grad school. So anyway, so The Wounded Soldier, Honey in Late Medieval Medicine, she theorizes that these stocks were for medical use, and there's some good logic behind this. First off, honey doesn't spoil. It's naturally antiseptic. It's a high enough pH or low enough pH that it's naturally acidic, it's antiseptic. Honey is used in modern medicine, even on various types of bandaging, because it is known it promotes healing of wounds. And from a practical standpoint, on the battlefield, particularly for minor wounds, honey works really well on a cut or a scratch. I've tried it on a bad cat scratch, just to say, hey, what happens? For one thing, you slather enough honey on, you're basically stopping the bleeding. You're gluing the wound shut. And it does prevent infection. It does, de Chauliac said that it minimized scarring. I can't speak to that really, because I haven't done a whole lot of practical application on it. But when I was teaching this class to Duchess Ebigardis, she's a nurse, and she was talking about how she had just read a paper on using honey to treat wounds. So we've got a case study here I want to talk about that kind of brings some of these points together to wrap up. It looks like I've got about 15 more minutes to go here. So that's about right. So the depth of 6 inches. So in 1403, Henry IV was King of England, and this is the period known as Hotspur's Rebellion in Wales. And in 1403, the 16-year-old Prince of Wales, the future Henry V, was severely wounded at the Battle of Shrewsbury. He took an arrow in the face. Given the armor of the time and everything, my hunch is that he basically, in a quiet moment, either needed to shout an order to someone or tried to get some air. He lifted his visor and he got an arrow in the face. His treatment and recovery is wonderfully recorded by the attending surgeon in a book called Philomena, and it shows in lovely detail how these various things that I've described come together, as well as it just shows the sophistication and the innovation of late medieval surgeons. So let's talk about this. So let's talk about the wound first. According to the surgeon, John Bradmore, Henry was struck by an arrow alongside his nose. Bradmore, in his narrative says he was struck on the left side of the nose. The difficulty I have, or that some historians, particularly Dr. Michael Livingston of the Citadel has, is that the only portraits we have of Henry show him in left profile, and there's no scar, and this would have definitely left a scar from what is described. So Livingston thinks he was hit on the left side if you're facing him. So on Bradmore's left side. So I actually flipped the picture. This is a lovely skull that is at Shrewsbury in their museum to show the horrible wound that the prince had taken. I've actually flipped the picture because I agree with Livingston's theory. So Bradmore was actually in London at the time of Shrewsbury. They had to send for him. He was the royal surgeon. He was King Henry's personal surgeon. The Prince of Wales has been shot in the face with an arrow. He lives, but he needs the best. So it took Bradmore several days to get from London to Wales. Other surgeons had attempted to pull the arrow out. What they had managed to do was get the shaft out. But the arrowhead was still left behind, according to Bradmore, lodged in the posterior part of the skull at a depth of 6 inches. So it basically, as best we can tell, went in through the sinus cavity, missed the brain, went under the brain, and lodged in the thick bone back there at the base of the skull. So the arrowhead is out, or the arrow is out, but the arrowhead is still in there. You've got the Prince of Wales, the heir to the throne. One assumes he's in a substantial amount of pain, even if you're using poppy juice, even if you're keeping him drunk, whatever. And he's a 16-year-old kid, 16-year-old young man. What do you do? Well, Bradmore, being a clever fellow, had a treatment in mind. In order to combat the swelling and to keep the wound open, what he did was he began inserting dowels that were wrapped in clean linen, again cleanliness, and dipped in honey into the wound. And then over the course of days, he increased the size of the dowels so that they could go in deeper and they were wider. This is a process that modern medicine calls dilation. Doctors' offices can actually, and hospitals can actually buy pre-made dilation sets for dilating wounds. And you basically keep the wound open and actually make it bigger over time. Until he got to the point, and he doesn't note how long this took. I'm assuming at least a week or longer because of the other things going on. The wound was sufficiently open for him to operate. Now, while he was dilating the wound, Bradmore was not standing still. He was hard at work designing and commissioning a new medical device. Henry had been taken to one of the royal castles in Wales. It was fully equipped with an armory and armorers, and that meant master smiths. This is a reproduction of Bradmore's extractor, the tool that he designed for this job. It consists of a set of tongs that are the width of an arrow shaft, and then a central screw. And when you run the screw down, it pushes the tongs outward. There's 3 tongs. So he could insert it down into the wound until he was basically into the arrowhead itself, which was thankfully a bodkin point and not, barbed. And then he expanded it so that it grabbed the inside of the arrowhead super, super tightly. And then he could draw the arrow out. This is, to my mind, just a remarkable achievement. He figured this thing out in a short period of time, commissioned it, which meant there were workmen who were able to do the work. It shows a tremendous degree of sophistication and thinking outside the box to get this done. Of course, once the arrowhead was removed, Bradmore now needed to fight the infection and promote healing, because if he just closed it up, you've got this huge gaping tunnel under the king's brain. So you have to heal it over time. First off, he irrigated the wound with wine. I'm sure that was a lovely experience, but he was again disinfecting it. He didn't necessarily know why he was disinfecting it. He knew he needed to disinfect it. He then began reversing the procedure with the dowels, working backwards. Now the linen was soaked in a medicine made of boiled breadcrumbs, barley flour, and again, honey. I've cautioned against reasoning from our knowledge. So I still want to put that caution in place. But a friend of mine who sat in on this class, who's an herbalist, wondered, and I will leave it at wondering, if the boiled breadcrumbs and barley flour at all made a rudimentary penicillin. It's an interesting thought. Again, it can't be proven. I don't want to go that far. Herbalism is not my thing. I don't know whether that was I'd be interested in looking at that connection, but I haven't had the time to do so. So I don't want to say, oh, and he's treating it with an antibiotic. No, I'm not saying that. He treated it with boiled breadcrumbs, barley flour, and honey. And I think honey is the important thing to look at there. It took 20 days of changing out the dowels. So we knew it took him nearly 3 weeks just to heal from getting the arrowhead out of the prince's head. And this is basically, in modern wound treatment, this is wound packing. And you basically let the wound heal from below. When it finally got to the point that he could heal the outer skin, he did so with an ointment made from rosin and gums, sticky stuff, just like an ER doc now uses super glue to close up a wound. A few weeks ago, I had a misfortune on a staircase and banged up my elbow pretty badly. And if you've ever cut an elbow, you know it's a lousy place to try and treat. And my brother, who is he's a retired paramedic, was advising me about using super glue. And he said, you don't need to buy anything fancy, just super glue off the shelf. It's antiseptic, it's fine. But we still close wounds with super glue today. Bradmore's super glue was made from various gums and resin. And this picture is from the otherwise awful The King from Netflix, Timothy Chalamet as Henry V. It is, for all of its flaws, one of the few Henry V stories that actually shows him with a scar on his cheek. Again, I flipped the picture, but at least it does show him with a scar. I don't think that's where he was wounded, but I'll take any picture that actually shows him with a wound, because even Shakespeare barely touches on the subject. And the interesting aftermath of this is when you look at Henry's campaigns as King of France, there are always multiple surgeons in his battle train. And they weren't his personal surgeon. Kings of England had been taking their personal surgeon on campaign forever. This was a corps of surgeons. So we're talking 6 or 7 trained surgeons, including the royal surgeon, and they were for all of the soldiers. Henry knew from this experience the value of having a surgeon on board and a surgeon handy. And to my mind, that changed a lot of things going forward with the way the English practiced warfare, and almost certainly as it was practiced on the continent. All right, we are right at 9:55, and we're wrapping up here. So, contrary to popular portrayals, the medieval surgeon was, I think we can say, often highly skilled and well-read. Surgeons performed complicated procedures and codified their methods. Granted, without the benefits of antisepsis, blood transfusion, a thorough knowledge of circulation, their success was limited by modern standards, but still, to my mind, remarkable in its efficacy. And I want to keep that in mind, when we think about medicine. I do have some sources and further reading. I can put up a link. I'll make sure a link goes on the page for King's College that has a link to the Dropbox where this presentation is, because it does have my sources in here. There's some good stuff. We got a couple of minutes here, so let me turn off the screen share. And if anyone's got any questions, I'll be happy to try and field something in the few minutes we've got left.
All right, sure, I'll try it. You listed a book at the beginning that as the bathroom.
Oh yeah.
Was that part of your
I think it
is that it?
is, but it's right here, Medicine and Healing in the Pre-Modern West by Winston Black. And the reason why I call it a good bathroom reader is he has written it for basically any level between like high school honors history students to undergrads. And it is also priced for undergrads. So I think the book is like $25 on Amazon.
Cool, thank you.
So, all right, anything else? Thank you all for your time. This was a lot of fun. And Bia, if you want to go ahead and stop the recording, I think you can.